I think it's important that moms-to-be take every precaution necessary.
A glass of wine a week, especially later on in pregnancy, is harmless.
There's no known safe quantity of alcohol consumption during pregnancy.
In my opinion, the safest choice is to completely abstain from alcohol during pregnancy. Alcohol exposure can create a developmental disorder called fetal alcohol syndrome, a situation in which a baby has minor birth defects and developmental delays that can cause lifelong consequences. We don't know how much alcohol is required to trigger fetal alcohol syndrome. Some women have had a baby with fetal alcohol syndrome after only having one drink during pregnancy. Mothers-to-be are so careful with medications, artificial food ingredients, even coffee while they're pregnant. In my opinion, stay away from alcohol during pregnancy. It's just not worth the risk.
In my opinion, Dr. Sears, complete abstinence is not always necessary. It absolutely is true that excessive alcohol use in pregnancy is extremely dangerous, especially in the first trimester or first 12 weeks when all the organs are being formed. Now, that all being said, occasional use, defined as, say, a glass of wine a week, especially later on in pregnancy, in the late third trimester, is harmless and actually can do a lot of good. At least once a day, I tell one of my patients who's around her due date or past her due date to please get in the bathtub, light some candles, and have a glass of wine. And it's really, really helpful for them.
Dr. Sears and Dr. Rothbard, I actually agree a little bit with both of you. Avoiding alcohol altogether is obviously the safest route. The concern with alcohol consumption during pregnancy is that it is the #1 cause of mental retardation and preventable cause of birth defects. Now, alcohol consumption during pregnancy may cause miscarriages, may cause infants with low birth weight. Fetal alcohol syndrome can show up in many ways in infants and children. It may show up with abnormal facial features, such as a flattened face, narrow eye openings, and even a small head. Infants may have behavioral problems and intellectual problems as well, such as low IQ, mental retardation and developmental delays, hyperactivity, poor memory, and a short attention span. So my common sense bottom line is, if you're worried about it, don't drink.